We are taking phone calls at 617-830-4750. We'll take our next caller. Who's on the line?
Hello, my name's Dave. I'm calling from Dallas, Texas. I really appreciate you taking my call.
My pleasure. What's on your mind?
I'm self-employed.
Okay.
Self-employed, so I rely on healthcare.gov for my health insurance.
Right.
And since you're also self-employed, I was wondering if you also rely on healthcare.gov for your insurance and how that's working for you if you do.
I don't rely on healthcare.gov because here in Massachusetts, we've had this thing called Romneycare longer than the Affordable Care Act, which is in many ways, it goes above and beyond the minimum requirements of the Affordable Care Act. So we have something in Massachusetts called the Health Connector, which is basically a way that you can see at a glance what plans are available. There's also some groups that let you do, small business group plans, etc. So I don't use healthcare.gov because we've got something else here in Massachusetts. And that's something I've been talking about in the discussion about whether Trump is going to keep or get rid of the Affordable Care Act. And we know he said some of the provisions are very good. It's possible he'll get rid of it and replace it with something very similar. Whatever else ends up happening, there are some states, I don't know what the list is, Massachusetts is one, that won't by and large be too affected by that because they have their own systems. And I know Texas is not one of those states, as you're telling us.
Yeah, that's true. Well, out of curiosity, what's happened to your premiums since in the last few years for people in Massachusetts? Have they skyrocketed or?
I don't have broader state data. The plans I'm aware of have seen slight increases and, premiums sort of always increase. And there have been slight increases. And I think it really matters whether, there's heavily subsidized plans through something called Mass Health where people actually don't pay anything in some cases. And then there's different gradations of subsidy. And then you've got just sort of like your regular market plans where you don't go through what's called the Health Connector. You just call up Harvard Pilgrim or Tufts or whatever health insurance company you want, and those may not be company names that resonate with people in other parts of the country, and you can just sort of buy directly. So, premiums have increased, but how it compares to what we were seeing pre-Affordable Care Act, I'm not exactly sure about that. But all very good questions, and we're going to talk about the impact of this on small business owners and others once we finally see what Trump Care is going to look like, Dave.
Well, for me personally, just real quickly, I've seen my insurance go literally as of this year. If I want to keep my doctor, I'll be paying 3 times more than I was paying just a few years ago before.
So the monthly premium would be, you're saying the monthly premium would be 3 times as much, and that doesn't count co-pays or anything else?
It would be if I want to keep my doctor. That's right. If I want to keep my doctor that I've had for 25 years,
yeah,
I would be paying $1,500 a month to keep her as my doctor. I can get another plan. It's the cheapest plan that's offered in Dallas, and it's almost $1,000 a month. And I was looking at the doctors. They don't even have real doctors. It's all physicians, assistants. They don't have any just general practitioners.
Oh.
My doctor won't even take the insurance, But here's the thing that has me really nervous about it, because I hear President Obama, when he was going around bragging about how 70% of the people through the affordable health care now get their insurance for less than $100 a month. And of that, the vast majority get it for less than $75. And the reason they're able to get it for that amount is the reason why I'm paying so much money every month. I'm literally subsidizing their health care, and they're pricing me out. And so I know the insurance broker that I used to use before the healthcare.gov site made it so easy for me to just pick it out myself.
Mm-hmm.
He's now reaching out to people like me, self-employed people, and he's telling us about these cost-sharing plans that are offered through ministries. I don't know if you're familiar with them or not.
I have not heard of that.
Get health insurance through they're offered through religious organizations. I'm
Right.
not really a religious person. I'm a spiritual person, but not a religious person. I can't stand the thought of getting my health care, relying on a religious organization for my health care. That just scares the hell out of me.
Yeah, that is very, very scary.
And they actually make it clear that they don't have to pay you. And they make it clear that they're not actually on the hook for your payments. they're supposed to pay for it. And the way it is, everybody chips in money and then they share the expenses and kind of a long story. I could be getting my insurance through them for $399 a month with the $1,000 out of pocket for the year, which sounds phenomenal to me.
Yeah.
But I don't want to do it because I don't want to be reliant on a religious organization.
Yep,
But
I
think there's
completely
gonna be a
agree
lot
with
of
you on that,
people
Dave.
like me.
I do have to move on. It's a very important issue which we're going to be covering, and fundamentally the system is just not a good system. That none of this should be for profit, and I really do appreciate the call and hope to talk to you again.